Hey everyone, Bridget here at the AAFE Training Center. We are just going to be doing some twisted smooth threads on my patient today. This is actually her second treatment with us, and we had been treating her nasolabial folds and her submental region with some twisted smooth threads. For this appointment, we are just going to be doing the submental region as she is wanting some lifting threads in her face later this month. So we are going to do that and then hopefully not have to do as many nasolabial fold threads. First thing, obviously I clean the patient off really well, and then I break through the skin, level off, and advance my thread in there. I want to make sure that that little marshmallow or pledget is pushed past the thread, or the thread will be able to basically migrate its way out. If that were to ever happen, we basically would just take a pair of sterile tweezers and pull the thread right out and then place a new one. I like to go in this sunrise fashion. I just feel like it really targets the submental pocket, or like that double chin as people like to call it, really well. I'm making sure to stay in that subdermal plane. Basically, I'm going to break through the skin, and then as soon as I break through, I'm going to level off my needle. For this patient, I selected the twisted 29x40 threads. I feel like they just give me the best tightening and smoothing effect in this area, and it also creates a little bit more trauma, so it's going to give you the most collagen stimulation possible. Once placing smooth threads, the patient can have some bruising and swelling in the area, and then there's also a risk of thread visibility and thread migration like I was talking about earlier. So I always make sure to make my patient educated about that so that they know when to contact me. I always make sure to turn the needle 360 degrees before taking it out, as that's what kind of engages the thread into the tissue. So I always make sure to do that. I then clean off my patient, and that's really it. Super quick and easy, and a really effective treatment.